Well, thank you, everybody, and welcome today. We're really excited to have you, and just listening to all of you with your varied professional backgrounds, that you bring that experience to the K&A and your work. All of the work that you listed that you do is just phenomenal. Thank you for all you do. Now I'm going to turn this over to Vivian and let her start our day and get us going.
Well, good morning, everyone. My name is Vivian Blade, and I am President and CEO of Experts in Growth Leadership Consulting. My primary work is to work with organizations to help them to build better leaders and better workplaces. And I've had the pleasure and the honor of working with K&A through some of your retreats, board retreats, and today in this leadership retreat, working with Donna, Dolores, Delano, to really help to bring you events such as this to help generate great ideas and bring some action, additional action to some of the work that you're doing. So I'm honored to be with such an esteemed group of professionals. So I'm just going to briefly go over our agenda for today and then turn it over to Delano to run with the presentation. The next item on the agenda. So, all right. So we've got a packed day, but such a great day ahead for you. Such an exciting day. And just initially, we're going to transition to the structure of K&A and the resources that you have available to you. So Delano will take care of that. We are so excited to then have Dr. Judy Gotzi and your president, Dr. Dolores White, take us into the brand image of nursing, the work that's being done there. And then we'll be able to spend our afternoon, a good portion of our afternoon, actually doing some work around what we can do in our chapters to move that forward. We will have a brief break in between, but we are going to have a working lunch as we get into that working session. So between the presentation by Dr. Gotzi and Dr. White, we'll just take a brief break for you to grab your lunch, take a bio break, and then we'll come back and begin our work in the afternoon. Then we'll follow that by Dolores and Delano taking us through some of the strategic plan where we have come to and how we can better engage there, more engage, I'll say, as chapters as we wrap up then our day with next steps. So that is what we have on tap for you. And with that, I will turn it over to Delano to continue with the structure of K&A and the organization.
Thank you, Vivian. I am so excited about seeing all of you guys. I know that you know that we do a lot of events and conferences and things like this, but this is my favorite one of the entire year is the leadership retreat. Because what happens during this is, as Kathy said, we have a lot of new people who are being introduced to the K&A and the things that we do, and to the K&A office and to their chapters. And so we have this great opportunity. And then we have our more seasoned people who have all that wisdom that they can share. But basically, we get to meet new people. We get to see people that we might want to have a conversation with, or someone you think might be able to help you get something done, or someone you think you might be able to help. So this is a tremendous opportunity. And I am so glad that you all were able to take some time out of your busy schedules, because I know you, even the retired people, as you could hear, they are working really hard. None of them are sitting at home eating bonbons, doing their nails and polishing their toes. So I can say, welcome and thank you so much for being here and wanting to be involved in K&A and help us with the image of nursing. I'm going to start out by introducing our home team and tell you a little bit about them, and if they're here, to have them to turn on their cameras and give a wave. As I mentioned, I'm Delano and I work for you. There is no mistake about who I work for. I work for the board and I work for you. That's it. But the home team, they work for me. So if you have an opportunity for me to help you, please contact me and I will delegate it out to the people who can help get it all done. First, I want to start with Kim Becker. She's our associate administrator, and I call her the mini me. So if I can't be there, Kim is probably going to be there trying to work and help you get whatever you need done. And then we have our communications person. That's Sarah Kelly. She's not on with us today, but she helps us with all of our communications like the e-news, the Kentucky Nurse, the special bulletin, those kinds of things. Sherry Chandler, are you here? Sherry Chandler? Oh, yes. Sherry Chandler is actually getting promoted, and that will become effective in this month. And she is our new membership manager. Next, we have Karen. And Karen is our graphic designer. She's been the KNA graphic designer for about 5 years. She actually lives in Chicago, but she is KNA through and through. I can tell you that. And Melissa Mershon, she helps us with our raffles and conferences and anything else that we need to have done. As many of you know, Melissa held the fort together until I could get here 5 years ago. And so she continues to work with us and to support the Kentucky Nurses Association. In fact, she was with us last night until about 8 o'clock working on the raffle. So that's Melissa Mershon. And then one other person that I don't have listed here is our lobbyist, and that is Julie Denton. And she's new to the team, and I think she's on her way to London, but she is part of our team as well. Next slide, please. So what I would like to do is kind of talk a little bit about what the home office can do to support all of you. And the first thing that I want to say is, as I heard many people talk about, they weren't quite sure about their chapter. That's okay. We're going to get you there, because it's your chapter unit that can really provide some foundation for things to get done. Many of you have been elected or been appointed to different committees or cabinets, but the interface with your chapter is really important. So if you have not had an opportunity to meet your chapter chair, if you've not had an opportunity to get to a meeting, I'm going to encourage you. I know that you can't make every meeting. Nobody can make every meeting, but many of the meetings are recorded. Many of the meetings are virtual. And in many of those meetings, you can do what we all do as nurses, and that's called multitask, so that you get an opportunity to have some interface. So I encourage you that if you have not had the opportunity to interface with your chapter, that you make that be one of the things that you do in the new, in the rest of the fiscal year. So in terms of what we actually do, we coordinate and structure events like the annual conference and like the legislative conference that's coming up, events like this. We even plan COVID missions. And so we coordinate things. That's one of the things that we do. We manage the data. And when I say the data, we do a directory, and you all should have received a copy of the directory. I hope that you will take a look at that. And if we have anything incorrect about you, if you would let us know so we can get that corrected and send out. That directory is for you to use so that you can connect with other leaders in the organization. Please feel free to use it, and please let us know if it's not correct. Now, in terms of data, we get majority of the data about you from your profile from ANA. It doesn't come directly to us. It goes to them, and then they give it to us. So when you have a change in job or change in email or a change in phone number, you have to notify ANA, and then they will notify us. We publish media. When I say media, I mean all the media, the social media, Twitter, Facebook, LinkedIn, Instagram, we do it all. We have a very active website. And one of the things I want to draw your attention to on the website is we have a search bar. So that if there is anything that you want to find on our website, use that search bar. We have we have search bars in a couple of places. We also have an e-news that we put out just for members. The second Thursday of the month, we try to make that deadline, and it just goes to members. So it's information that only members would benefit from or can use. For instance, it is now time that if you're interested in serving on the Kentucky Board of Nursing, that you should submit your application. That's a members only opportunity. If you're not a KNA member, you cannot apply. I mean, you will not be selected or considered for appointment. So that's the type of news that comes out in the e-news. We put out the special bulletin 8 times a year. And then we put out that award-winning newsletter that Pat Calico and Ida Slusher participate with 4 times a year, the Kentucky Nurse. So we have a lot of venues to try to communicate with members and other nurses to keep you informed about what's happening in nursing, in our profession, what's happening with the ANA, and what's happening with the KNA. We also have an affiliates group, and we try to keep up with all the things that are going on with their organizations and share that information with our members as well. I just mentioned about the KBN nominations, Nightingale activities. As you heard Deb Raymond talk about coordinating Nightingale activities, I want to encourage all of you who are doing these Nightingales, because they, first of all, they are so important to the families as well as to the nurses who get the opportunity to participate, to make sure that you're sharing the names, and if you have photos of the people where you have the opportunity to do a Nightingale tribute, share it with the home office. You can send it to the admin email address. And also, if you need assistance or you have questions, Deb Raymond, and you can look her up on the KNA 365 app. I mentioned about publishing media, but I didn't mention the KNA 365 app, which is my baby, actually. The KNA 365 app, everybody should have it. If you don't, go to your store, your app store, and download it. And then put in your email address, and there you go. You have access to every member in KNA. So please, if you have not downloaded the KNA 365 app, please do that. And every group that you belong to is on that app as well. So you can communicate with all of those people who are in that particular group. We coordinate the chapter challenges. We do a voter challenge, which Reach won last year. They got the most voters out to the polls for the KNA election. We do the membership challenge, which is in April and May during Nurses Month. And we do all different types. We did a profile challenge for people to update their profiles in terms of their ethnicity, so we could identify our opportunities to increase our diversity in the KNA. We support chapter and committees and boards. And what I mean by that is for some of our boards, we start the Zoom link. For some of our, in terms of getting information out to the boards. So we support chapters. And if you need something for your chapter, we are your resource. Please contact me. We manage the fiscal year. When I say the fiscal year, our fiscal year is July 1 to June 30. And you might ask, why is it important that you know that? Well, June 30, when it rolls around, July 1 is when you need to start thinking about sending me your financial reports from your chapter. The other thing is, in terms of that fiscal year, it's important when you're looking at grants. They might want to know if you are on a calendar year or a fiscal year. It also makes a difference to our budget. We talk about growth funds. Growth funds are for the fiscal year, not for the calendar year. So again, I want to say July 1 through June 30. And also it's important that you know that the KNA is a 501c6. The KNAC is a 501c6. And the KNF is a 501c3. Now, the most important thing that you need to know about that is, and for many of the grants that you are applying for, they want to know what is the tax status of the organization. And so that is why that's one of the reasons that it's important that you know about our tax status. We are responsible for the image of nursing in the state of Kentucky. It's our responsibility. It is our pleasure. It is our honor to be the organization that is responsible for our image. And so to go along with that, I try to make, you notice the background, whenever I'm on, I try to have my K&A in the background so people know where I'm from. I wear my name tag, I wear my button, and I can tell you that every time I get a chance to talk to people, one of the first things I tell them is, I'm the CEO for the Kentucky Nurses Association. There is no one in my sphere of influence who does not know, first of all, that I'm a nurse, and number two, that she represents those nurses. That's an opportunity for you as well, to help us to manage the image of nursing. And every opportunity I get to talk to the media about K&A or nurses, my answer is yes. When can we do that? So we're responsible for the image of nursing. And one of those other things is, you'll notice our logo. About 3 years ago, our logo changed. And so we are not the American Nurses Association Kentucky. We are the Kentucky Nurses Association. Since 1906, now that we've gone through some name changes, like we were the Graduate Nurses Association and that type of thing, but we are the Kentucky Nurses Association. So one of the things that all of you all, when you're using our logo, make sure you're using the right logo. We want people to realize we are Kentucky Nurses Association. Make no mistake about that. So another opportunity there in terms of managing the image of nursing. The other thing, when we're talking about the image of nursing, you will notice that we are very strategic and intentional about how we portray nurses in the media. We have a license plate that's coming up. It's going to be available in March, February? March, okay. And it is being hosted by the Kentucky Nurses Foundation. I hope that you all will all consider purchasing one, and it is open to anyone that supports nurses. When we worked on the design, we had the design committee. We were very strategic and intentional to make sure that the image of this license plate was something we wanted for nurses. We wanted it so that it showed all nurses, not just nurses who work in a specific area. So when you see this nurse's license plate, know that it was a labor of love and an opportunity for us to have the image we want for nurses. And you're going to hear a lot more about that when we have our speakers come. I got to go fast. Okay, we manage our celebration and appreciation of nurses through our awards. If you see and hear about any award where they want to know about leaders, we should be nominating some nurses. And so there's an opportunity for us to nominate nurses. Let us know about that. CE process, as Nikki said, she's responsible for approving the CEs. We do CEs for any organization. If you are a member, that's a free process. If you belong to an organization that is not a member of the affiliates or the K&A, then they have to pay for us to process the CEs. We manage our finances. That includes making sure that we finish with that we do our taxes and we abide by the IRS. We have an online store. We manage the volunteer program. We do the clinics, and we manage the statewide elections, which are in August. And we are coordinate with ANA, and we plan and execute advocacy and policy. Next slide, and I got to go really fast. I know, 3 minutes. Okay, here we go. Chapter leaders. Chapters. You all are the foundation and lifeblood of the K&A. Your role is to support your members and the students and the community. Have input into policies and procedures. To do the chapter reports are an opportunity for you to tell everybody what things you guys are doing. And we put those chapter reports in the Kentucky Nurse on a quarterly basis, and also an annual report in the yearbook. If you would, when you do your elections, please let the home office know your election results, who's your new people and the ones that are staying. Please encourage your members to keep their profiles with ANA up to date, and let us know about your community activities. If we can get there, we'll be there, I can assure you. Please involve your students in your chapters, invite them to your meetings, and invite them to participate in your community activities. Please send your minutes to the home office from your meetings. and file your fiscal report in July. Did I do it? I did it. I'm done. I got 2 minutes to spare. I'll take questions. No questions? Oh, well, that's wonderful. Thank you. I appreciate it.
Eleanor, I don't have a question, but when you were talking about our different publications and things, can I put in a plug that right now the editorial board is taking nominations we have an editorial board position open, and you need publishing experience for that. It's great if you've been on a board of another journal, but we are accepting applications for that. You go in and onto the website and get a consent to serve form and submit that with your CV. The other thing, if you don't have the publishing experience or maybe don't have as much time, we also are open to reviewers for the Kentucky Nurse. So both of those we are needing as soon as possible. Thanks.
Okay, any other questions or comments? And I thank you for your attention. I know I went really, really fast. Email, text me, call me. Okay, Vivian, back to you.
Okay. All right. Well, I think at the end of the day, what you can see is that the KNA provides so many resources for you to support you as chapters, as members, and to support this profession and to advance it forward. And the chapters also play such an important role. So we are so glad to have you here. So glad that you have stepped up in these leadership roles to help us to advance the profession of nursing.
Okay, so Vivian, should I go ahead and get started with the
Yes, ma'am.
strategic plan? First, I would like to say that many of the things that you all talked about today and those who were in the board's retreat yesterday are in the strategic plan. So you know that we're going in the right direction. I'm going to start out with our mission, vision, values, so that it becomes very clear that our strategic plan is built on those things. Okay, so the vision for the KNA is to be the voice for nurses and to work for a healthier Kentucky. And then our mission is advocating for, engaging with, and advancing the professional practice of nursing through leadership development, evidence-based practice, education, research, membership growth, and health policy. Are we on the right track or what? And our values are that through our actions, nurses will promote quality health care, strengthen health awareness, and direct health promotion leading to improved health outcomes. Our values, and I can tell you that our values are one of the things that made me say yes when I was asked to join the team. Our core values include diversity and inclusivity, high ethical standards, lifelong learning, accountability, and stewardship. And as you well know, all strategic plans, all good strategic plans are built on mission, vision, and values. And so ours is a good strategic plan, so it's built on those things. So we're going to start with membership. As Bill mentioned, membership in professional nursing organizations is dismal. We need to really work on that. I'm going to do this a little different because you can read yourself what's on the screen, but I want to just make sure that you are aware of the things that we are focusing on so that we can go through this pretty quickly and talk about how we're going to, again, encourage your chapters, committees, cabinets to participate in being part of the strategic plan. In June of 2022, which is at our end of our fiscal year, the boards came together for a retreat. We do 2 retreats, one in June, which is at the end of the fiscal year, and one in December, which is mid-year of our fiscal year. And the boards looked at the strategic plan from 2020 to 2022, and they revised it. And so now we have a strategic plan for 2022 to 2024. So we have an opportunity to get some work done. So and membership being our first one, we have our affiliates program, but we need to expand that. We only have 20 affiliates right now, and I'm sure that Donna and Dolores are saying, I thought we had 22 yesterday. I thought we had. There are people who haven't paid their dues. We got to work on that. But there are lots of organizations that want to support nursing and nurses. We need to recruit them to the fold so that we can educate them about what we want them to know about nursing and nurses. Next slide, please. Also in membership, we said that we want to launch a campaign to encourage in current member profile completions, gender, race, and ethnicity. One of the things that needs to happen is that the ANA needs to collect that data. And in 2023, 2024, they're going to put that software in place. And also the KBN data that they collected about our demographics as we applied for our relicensure will help us to know what the demographics are in our state, and that will also give us some place to work. And so we're working on the software from ANA, working on getting results from the KBN, and then that leads us to the third one, which is the KNA will launch a membership drive with a targeted goal of 10% increase in membership of nurses of color. And we cannot achieve that if we don't have a baseline. So that we are definitely working on that. Next, our strategic plan focus number 2 is practice development, education, research, and leadership. My goodness, does it fall right in line with what we've been talking about? And so the first measurement is to improve technology and increase educational opportunities. As we were talking about technology being one of those things that nurses need to participate in and let other people know. We can engage in technology. If we didn't engage in technology, would it be happening in healthcare? And the answer is no. So just to let you know, if you were to, when you get this slide deck, you can look at the specifics, but we have done a great job with social media, as well as with our e-news and our Kentucky Nurse. But you should review those and you should help us to increase our visibility through technology and through the social media. Next slide, please. Next is our focus is on advocacy and health policy. And as I heard lots of people talk about advocacy, we need to have advocacy for nursing, the nursing profession, and nurses. And then in terms of health policy, we do a great job in identifying what our policies are going to be for us to focus on, and including how we're going to lead that policy into legislation. And as you can see, we're doing a lot of presentations, but I know that this list is incomplete. I know that there are chapters out there that are in the schools. I know that there are individuals that are doing talks, as Dawn Balcom was talking about, that we don't have on this list. So please send us to the KNA office when you're doing presentations and who you're doing presentations to, so that we can include it, so that we can evaluate how we're doing. Also in strategic plan number 3, our measurement number 2 is to develop and implement an annual KNA legislative agenda by January of each year. We do a great job of doing that. We already have our priorities for 2022, 2023. And we're prepping for our Nurses Day at the Capitol on March 1. We hope that you will join us and bring your colleagues and your students. When I hear from other nursing associations that they have 800 people go to their state capitol for their Nurses Day, I get jealous. We can do that. The most that we've ever had is about 250. I'm shooting for that 800 number. And then we have our legislative and leadership and legislative academy that we started, and it began on November the 1st. And we have 18 fellows, and so far it is going great. And then we had our KNA Governmental Affairs Chair testify about the nursing shortage to the Interim Joint Committee on Licensing, Occupation, and Administrative Regulations on October the 27th. If you're testifying and you're representing nurses, tell us about it. First of all, so we can watch and support you, but also so that we can put it on our record to say, these are the things that we are doing to help us to achieve success with our strategic plan. Next slide, please. And then the third measurement is develop and implement the annual KNA, the legislative agenda, our legislative priorities for 2022 and 2023. The primary focus is workplace violence prevention, and then workforce support, which is addressing the nursing shortage, and decriminalization of nurses. Now, these are some of the same things that the ANA is focusing on nationally. And then we are strongly supporting the restructuring of the Kappa CS, and that's a focus on access to care. And then the School Nurse Initiative, and then the SANE Nurses Initiative. Now, you may ask, what's the difference between primary focus and strongly support? Primary focus means that we are doing the advocacy and the health policy support, which may hopefully lead to some legislation. Strongly support are those things that if there are other organizations that are asking for our support, we've already said we will support this type of legislation or policy issue. Also in advocacy and health policy, KNA will present 20 community forums, information sessions in Kentucky to spotlight the organization. As you can see, we have quite a few, and we're only at the first 6 months. Again, share with us what you're doing so we can add that to our tally of what we're doing to achieve our strategic plan. Strategic plan focus number 4, voice and visibility. My goodness, image of nursing, opportunity. So these are some of the things that we've done in the last 6 months, and I'm sure that a number of you have done other things that we don't have on the list. Please let us know. But this is the first 6 months. We have 2 whole years to achieve this strategic plan outcome. And the second one that we are using as an outcome measurement is increase social media site visits by 20%. Now, as you can see, we're doing a very good job with social media, but many of you could go to our social media and we could increase these numbers even more and share with your colleagues so they can read about what we're doing, how we're doing, and maybe participate with us. So you do it, you share it, and then have them to share it with someone else. Next, this is still with voice and visibility. Focus number 4, increase nurses on boards and commissions by 15% annually. We have knocked it out of the park on that one. However, as we mentioned earlier, one of the ways that you get it out to the community that we are nurses and that we have something to share and something to provide in terms of leadership is to be on boards and commissions. And I encourage you to think about boards and commissions that are not the ones that they typically think of as those that nurses would be. For instance, what about EPA? What about the water board? What about air board? There are a number of other places. What about the school board? Where can you be on a board or commission and tell people that you're a nurse, you have something to contribute? And then number 4 is promote and expand the Nightingale Tribute Program by 50% annually. We are doing a lot of Nightingale tributes. We need for you to tell us when you're doing those. We presented 84 nurses at our business meeting, and last year we did 85. I know we're doing a lot more, so please let us know when you're doing a Nightingale tribute, and encourage your colleagues to go with you to honor our colleagues when we're doing the Nightingale tributes. Also in voice and visibility, maintain a volunteer program. We have a very engaged volunteer program. However, I know that there are more chapters that are engaging other volunteers. So far in the first 6 months, we have engaged 1,054 hours, and we've saved a lot of money. And volunteers can come and work at the KNA office. They can work in our mobile missions. They can work with chapters. We need to know about those volunteer hours. And then number 6 as an outcome is to spotlight a minimum of 2 nurses who work in diverse, that's non-traditional, non-clinical or bedside roles through social media and other publications. And I just want to do a shout out to our Nurse Researcher of the Year, Dr. Judy Godsey. Someone wonderful, and he lives in her house, spotlighted her on Instagram, Twitter, and Facebook after she won that award. And then also Ida Slusher, Dr. Ida Slusher has been spotlighted as a retired educator who traveled to Kenya for a mission trip to educate and care for children. And she was spotlighted on Facebook, Instagram, and Twitter. And so again, as you're doing those things, please let us know so that we can put it on our tally to say we are moving in the right direction for our strategic plan. And last but not least is our focus on financial stability. If we had more members, we could do more with our brand image, with education, with getting out there and letting the community know who we are and what we do. In terms of sustainability, membership cannot be our only income source because we don't have enough members to make that all happen. We have developed a grant obtaining process, and we're doing very well in terms of grants. But one of the things I talked about earlier this morning is to give you our tax status. So as you're looking for those grants, that you can say, okay, we should do that grant through the KNF because they're a 501c3. Also, our LMS is a revenue generating sustainability avenue, and it's available 24 hours a day, 7 days a week. And as you're doing your CEs, if you will allow us to record those, then we can put it up on the LMS, and that helps us to generate some money. It's not a lot, but it is some. Also, our affiliates membership, we don't charge affiliates much, it's just a little bit, but that is a sustaining avenue as well as our providers for the CEs. If you're not a member of KNA and you want us to approve your provider class, then that cost. So that's a sustaining avenue for revenue. Website store product sales, please purchase. That is another avenue where we can make some money. And then the Nursing Healing Hands of Hope, that's our license plate that will be available in March. And so please purchase that. That's $10 of every purchase of the license plate that will go to KNF so that they can give the money away for nursing students and for nurses to continue their education. Annual conferences, we had a very low annual conference registration this year. It's the lowest that we've had in a very long time. We had 98 people, not even 100. But that is a way that we can have sustainability in terms of bringing money into the KNA. Did I miss anything? Oh, social justice movie night, I missed that. We expected that to be a loss leader, but that is bringing in a little bit of money. And it is bringing money in from people from all over the country who have come to our social justice movie nights and participated with us. So that is how we are focusing on financial sustainability. And if you have any other ideas how we can generate non-dues revenue, we're all ears. And that's all I have in terms of the strategic plan. So what I want to say is we're at 2 o'clock already. So let me just say, thank you all for being here today. Thank you for being engaged and participating. And I'm going to let Vivian close us out and then Dolores.
All right. I just want to say it's been a pleasure to be with you all. And I am just inspired by the work you do every day, and then the work that you have done, the ideas that you have come up with in this session today. So thank you for taking your time out to be here. And again, I look forward to seeing all the tremendous impact, continued impact that the Kentucky Nurses Association and your chapters across the state will be making for the advancement of nurses. And with that, I'll turn it over to Dolores.
Thank you. And I thank you all as well. Thank you for being here and participating in this wonderful day. It's been a lot of great work that has already been accomplished, and I'm so excited to see where we go from here with our strategic plan and promotion of the brand image of nursing in all of your committees and cabinets and chapters and boards. So thank you for all that you do and your work in the breakout rooms today. I hope you feel inspired and ready to go forth and do great work with your members of, again, your chapter, committee, cabinet, board, whatever you're involved with. And, thank you for being amazing KNA leaders. You truly make a difference every day in what you do, and have a fabulous rest of your day and weekend.